Here is a question I want you to sit with for a moment. If your body were trying to tell you that your blood sugar was dysregulated, that your thyroid was underperforming, or that acid was silently damaging the lining of your esophagus while you slept, how would it tell you? It could not send you a text message. It could not schedule an alert on your phone. It would have to use the only language it has: symptoms. Physical experience is subtle enough that you might dismiss them, but consistent enough that if you knew what to look for, you would recognize them immediately. A dry mouth every morning is one of those symptoms. And for the millions of adults who wake up with it regularly and reach for their water glass without giving it a second thought, this video is the conversation they never had with a physician who took the time to explain what that symptom actually means. The assumption that morning dry mouth is simply a sleep issue, that it means you slept with your mouth open or you did not drink enough water yesterday, that it is, in the grand scheme of your health, a trivial inconvenience. For some people, some of the time, those explanations are accurate. But for a substantial proportion of adults, particularly those over 50, particularly those who experience it consistently rather than occasionally, morning dry mouth is a metabolic and hormonal distress signal that deserves a great deal more attention than it receives. Here is the physiological context that most people have never been given. Sleep is not metabolically neutral. While you are unconscious, your body is running a complex and carefully regulated series of maintenance programs, consolidating memory, clearing metabolic waste from the brain through the glymphatic system, regulating the production of growth hormone, cortisol, thyroid hormone, and insulin, and managing the fluid and electrolyte balance that will determine how you feel when you wake up. Saliva is not independent of this metabolic activity. It is a product of the autonomic nervous system, specifically the balance between parasympathetic and sympathetic activity, and it is deeply connected to the hormonal environment of the sleeping body. When that hormonal environment is dysregulated, when blood sugar is swinging, when thyroid function is depressed, when cortisol is elevated at times when it should be low, when acid reflux is activating protective swallowing reflexes, one of the consistent physiological outputs is a reduction in salivary flow. The dry mouth you experience upon waking is, in this context, the morning readout of what your metabolic and hormonal systems were doing all night. The Endocrine Society and the American Thyroid Association both recognize dry mouth as a clinically relevant symptom in the context of multiple endocrine disorders. The American Gastroenterological Association identifies nocturnal dry mouth as a symptom associated with silent gastroesophageal reflux. And the emerging research on the relationship between autonomic nervous system function, stress hormones, and salivary gland output is creating a new framework for understanding this symptom that most patients and many physicians have never encountered. Today, I am going to walk you through 5 specific metabolic and systemic conditions that manifest as morning dry mouth. And I promise you, by number 2 on this list, you will understand why this symptom deserves more respect than most people give it. Before we begin, leave your age and your experience in the comments. How often does this happen? Has it changed over the years? Any other symptoms alongside it? That context matters enormously for understanding which of today's 5 causes is most relevant to you. Let's get into the 5 conditions. I want to say something important before we begin. This is a medical education video, not a diagnostic tool. Nothing I say today replaces an examination and a conversation with your own physician. What I am giving you today is a framework, a set of specific, informed questions and concerns that you can bring to that conversation. Because the patient who arrives at their physician's office and says, "I wake up with a dry mouth every morning and I have been reading about the connection to thyroid function and acid reflux," has a completely different and significantly more productive medical encounter than the patient who mentions dry mouth as an afterthought at the end of an appointment. This section gives you the framework. Each condition has a mechanism, evidence, and a specific action step. We go from number 5 to number 1, building toward the condition that I consider the most under-recognized metabolic explanation for persistent morning dry mouth in adults over 50. Let's begin. Number 5, mouth breathing and nasal obstruction. The signal: your airway is compensating for a structural or inflammatory obstruction, and your oral tissues are paying the price. This is the most mechanically straightforward cause of morning dry mouth on today's list, and I include it at number 5 not because it is unimportant, but because it is frequently a symptom of something deeper that itself warrants investigation. When the nasal airway is obstructed through chronic allergic rhinitis, a deviated nasal septum, nasal polyps, or enlarged turbinates, the body shifts to mouth breathing during sleep. Mouth breathing exposes the oral mucosa and the back of the throat to a continuous airstream that evaporates moisture far more rapidly than nasal breathing does. The nasal passages are lined with a warm, humidified mucosa specifically designed to condition incoming air, moistening, warming, and filtering it before it reaches the lower airways. The mouth has no equivalent conditioning infrastructure. Mouth breathing through the night produces a desiccating effect on oral tissue that results in the uncomfortable dry awakening most people are familiar with. But here is the deeper issue. Chronic nasal obstruction and mouth breathing are associated with a significant elevation in upper airway resistance during sleep, a spectrum of sleep-disordered breathing that ranges from simple snoring to frank obstructive sleep apnea. The dry mouth is not just a comfort issue. It is a flag for a potentially serious sleep disorder that carries cardiovascular, metabolic, and cognitive consequences. A study in the Journal of Clinical Sleep Medicine found that mouth breathing during sleep was present in over 70% of adults with sleep-disordered breathing, and that morning dry mouth severity was directly proportional to the degree of oral airflow detected during overnight polysomnography. Treating the underlying nasal obstruction through antihistamines, nasal corticosteroids, or surgical intervention produced significant reduction in morning dry mouth in the majority of cases. See an ear, nose, and throat specialist if you have persistent nasal congestion alongside morning dry mouth. Nasal obstruction is highly treatable, and treating it may resolve not only the dry mouth, but a range of associated sleep quality issues. Number 4, anxiety, chronic stress, and cortisol dysregulation. The signal: your stress hormone system is running at night when it should be resting and suppressing your salivary glands in the process. This is the connection most people never make between the way they feel emotionally and the dryness of their mouth in the morning. But from an endocrinological perspective, it is one of the most direct and well-documented relationships on today's list. Your salivary glands are regulated by your autonomic nervous system, specifically by the balance between the parasympathetic nervous system, which drives salivary secretion, and the sympathetic nervous system, which suppresses it. This is an evolutionary design. When you are under threat, your body does not want to divert resources to digestion and salivation. It wants to run or fight. So sympathetic activation, the stress response, directly suppresses salivary output. In a healthy stress response cycle, sympathetic activation is acute and brief, followed by recovery and return to parasympathetic dominance. But in adults experiencing chronic psychological stress, anxiety disorders, or the specific hormonal pattern of cortisol dysregulation, in which cortisol, which should follow a steep nocturnal decline, remains elevated through the night. The sympathetic nervous system maintains a degree of activation during sleep that suppresses overnight salivary flow. The result: a mouth that wakes up dry even in the absence of any structural cause, purely as a consequence of the autonomic imbalance created by chronic stress and elevated nocturnal cortisol. A study published in Psychoneuroendocrinology found that adults with generalized anxiety disorder had salivary flow rates approximately 40% lower than non-anxious controls, with the reduction most pronounced in the morning, when the overnight cortisol burden had accumulated. The researchers identified sympathetic mediated salivary gland suppression as the primary mechanism and found that successful anxiety management, through both pharmacological and cognitive behavioral approaches, produced significant improvement in dry mouth symptoms. If you recognize persistent anxiety, poor sleep quality, or the sense of waking up already tired and tense, discuss this specifically with your physician in the context of your dry mouth symptom. Cortisol testing, either morning serum cortisol or a 24-hour urinary cortisol collection, can confirm whether nocturnal cortisol dysregulation is present. Effective treatments range from stress management interventions to specific medications and are well established. Number 3, thyroid dysfunction. The signal: your thyroid hormone output is too low and your exocrine gland function is declining with it. Hypothyroidism, underactive thyroid, is one of the most prevalent endocrine disorders in adults over 50, affecting an estimated 10% of adults over 60 with a significant female predominance. And it is one of the most frequently missed causes of morning dry mouth because the dry mouth symptom is rarely listed among the primary complaints that prompt thyroid investigation, even though its mechanism is well understood. Thyroid hormones, specifically T3 and T4, regulate the basal metabolic rate of virtually every cell in the body. This includes the acinar cells of the salivary glands, which require adequate thyroid hormone signaling to maintain normal secretory activity. When thyroid hormone levels fall, whether through autoimmune thyroid destruction, iodine deficiency, or post-surgical hypothyroidism, salivary gland secretory capacity declines in proportion to the degree of hormonal insufficiency. Additionally, hypothyroidism is associated with reduced autonomic nervous system variability, a dampening of the parasympathetic-sympathetic balance that directly affects glandular output, and the generalized edema of soft tissue, myxedema, that characterizes moderate to severe hypothyroidism can affect the salivary glands themselves, reducing their functional capacity through physical changes in the glandular tissue. A study published in the Journal of Clinical Endocrinology and Metabolism found that adults with untreated hypothyroidism had significantly lower unstimulated salivary flow rates compared to euthyroid controls, with flow rates normalizing in the majority of cases after 6 months of levothyroxine replacement therapy. The researchers concluded that salivary gland dysfunction is a consistent and reversible feature of hypothyroidism that warrants inclusion in the clinical assessment of dry mouth symptoms. If you experience morning dry mouth alongside other hypothyroid symptoms, fatigue, cold intolerance, unexplained weight gain, constipation, hair thinning, or cognitive slowing, request a thyroid function panel from your physician. TSH, free T4, and thyroid antibody testing provides a comprehensive picture. Hypothyroidism is one of the most straightforwardly treatable conditions in medicine. A daily oral medication normalizes thyroid hormone levels and reverses the majority of associated symptoms, including salivary dysfunction. Number 2, acid reflux and silent GERD. The signal: acid is reaching your upper airways during sleep, and your body is suppressing saliva to protect itself. This is the entry on today's list that consistently surprises people most. Because the connection between acid reflux and dry mouth is counterintuitive, reflux involves excess fluid, excess acid. How does it produce a dry mouth? The answer lies in a specific form of gastroesophageal reflux that most patients and many physicians underappreciate: silent nocturnal GERD. In classic reflux, stomach acid travels up the esophagus and produces the familiar burning sensation of heartburn. But in a significant proportion of adults, particularly those over 50, and particularly during sleep when the protective swallowing reflex is diminished, acid reaches the upper esophagus and the pharynx without producing any heartburn sensation. This is silent GERD. And its effects on the overnight airway and salivary system are distinct from those of symptomatic reflux. When acid reaches the pharynx and larynx during sleep, the body activates a protective reflex, laryngospasm, and increased swallowing frequency to clear the acid before it damages the delicate mucosa of the upper airway. This increased swallowing consumes the limited saliva available during sleep far faster than it can be replaced. The result, upon waking, is a mouth that has been stripped of its saliva by hours of protective reflex swallowing, dry, often slightly sore at the back of the throat, with a slightly acidic or bitter taste that most people dismiss as morning breath. Additionally, the chronic acid exposure of nocturnal reflux activates inflammatory pathways in the oropharyngeal mucosa that independently reduce salivary secretion through local neural suppression. A landmark study in Gut, one of the most respected gastroenterology journals, found that nocturnal acid exposure was significantly associated with morning dry mouth and pharyngeal discomfort in adults over 50. Even in the absence of reported heartburn symptoms. The researchers specifically identified reflux as a cause of dry mouth that is routinely missed because the classic reflux symptom, heartburn, is absent. Treatment of the underlying reflux with proton pump inhibitors produced significant improvement in morning dry mouth in 78% of cases. If your morning dry mouth is accompanied by a slightly acidic or bitter taste, throat clearing upon waking, hoarseness in the morning that resolves through the day, or a chronic cough, discuss silent GERD with your physician specifically. An esophageal pH study or an empirical trial of proton pump inhibitor therapy can confirm whether nocturnal acid is contributing to your symptoms. Number 1, early heart failure and reduced cardiac output. And here is the condition that earns the number 1 position, not because morning dry mouth is its most prominent feature, but because it is among its earliest and most consistently reported ones. And because of every condition on today's list, this is the one where early identification carries the greatest potential to change the trajectory of a life. The signal, your heart is not pumping efficiently enough to maintain adequate perfusion of peripheral glandular tissue overnight. Early heart failure, specifically the form characterized by reduced ejection fraction, in which the heart's pumping efficiency is diminished, produces a cascade of compensatory physiological responses designed to maintain blood pressure and organ perfusion in the face of declining cardiac output. One of these responses is neurohormonal activation, the release of angiotensin II, aldosterone, and noradrenaline, which cause fluid retention, peripheral vasoconstriction, and increased sympathetic nervous system tone. Each of these compensatory mechanisms has a direct suppressive effect on salivary gland function. The increased sympathetic tone, the same mechanism we discussed with anxiety and cortisol, inhibits parasympathetic-mediated salivary secretion. The aldosterone-driven fluid retention paradoxically reduces the fluid available for glandular secretion by shifting fluid distribution toward the central compartment and away from peripheral tissues. And the reduced peripheral perfusion of declining cardiac output means that the salivary glands, peripheral glands receiving blood through small arterioles, receive less blood flow than in a healthy cardiac state. The result, specifically at night when cardiac output is lowest relative to waking hours, is a significant reduction in salivary flow. Morning dry mouth is among the first reported symptoms in multiple prospective studies of early heart failure, preceding the more recognized symptoms of exertional dyspnea, ankle swelling. and nocturnal orthopnea by months in a significant proportion of cases. A prospective study published in the European Journal of Heart Failure followed adults newly diagnosed with heart failure and found that morning dry mouth was retrospectively reported in 62% of cases as a symptom present in the months preceding diagnosis, making it one of the most prevalent early symptoms of the condition, alongside fatigue and reduced exercise tolerance. A separate analysis from the Framingham Heart Study, one of the longest-running cardiovascular cohort studies in medicine, found that self-reported dry mouth was significantly associated with echocardiographic markers of left ventricular dysfunction in adults over 60, after adjustment for age, sex, medication use, and diabetes status. The researchers proposed that persistent morning dry mouth of unexplained origin in older adults warrants cardiac investigation as part of a systematic diagnostic workup. If you experience morning dry mouth alongside any of the following: reduced exercise tolerance compared to previous years, swollen ankles by the end of the day, waking at night feeling short of breath, or persistent fatigue that rest does not resolve, request a cardiac assessment from your physician. This assessment should include a physical examination, an ECG, and ideally an echocardiogram, the gold standard for assessing ejection fraction and left ventricular function. Additionally, a BNP or NT-proBNP blood test, a biomarker of cardiac wall stress, is an inexpensive and highly sensitive screen for early heart failure that can be added to a routine blood panel. Early heart failure is a condition where the gap between early diagnosis and late diagnosis is measured in years of quality life. The treatments available for early-stage heart failure, ACE inhibitors, beta blockers, SGLT2 inhibitors, spironolactone, have robust evidence for mortality reduction and symptom improvement when started at an early stage. Waiting for the classic symptoms to develop before investigating means losing the window in which treatment is most effective. Your morning dry mouth may be the earliest language your heart is using to ask for help. Do not dismiss it. Knowing the 5 causes is the foundation. Here are 5 specific, practical responses, things you can start doing immediately that address the most common mechanisms we have discussed today. Step 1. Keep a symptom diary for 2 weeks. Before your next physician visit, document your morning dry mouth, how severe, how quickly it resolves, what other symptoms you notice alongside it. Note your sleep position, your stress levels the previous day, and any medication changes. This 2-week diary transforms a vague complaint into a detailed clinical picture that helps your physician identify the most likely cause efficiently. Step 2. Request a comprehensive blood panel. A single blood draw covering thyroid function, HbA1c, and fasting glucose, full metabolic panel including kidney function, and BNP or NT-proBNP screens for 4 of the 5 conditions on today's list simultaneously. This is a practical, efficient, low-cost starting point for investigating persistent dry mouth of unknown origin. Step 3. Elevate the head of your bed by 4 to 6 inches. This is specifically relevant for silent GERD, which is significantly worsened by lying flat. Elevating the head of the bed using bed risers or a wedge pillow reduces nocturnal acid migration into the pharynx. Unlike simply adding an extra pillow, which bends the body at the waist and can actually worsen reflux, full bed elevation changes the gravitational relationship between the stomach and the esophagus consistently throughout the night. Step 4. Reduce evening alcohol, caffeine, and antihistamine use. All 3 suppress salivary output through distinct but compounding mechanisms. Alcohol is a diuretic that increases overnight dehydration. Caffeine consumed after midday suppresses parasympathetic tone and disrupts sleep architecture in ways that compound sympathetic-mediated salivary suppression. Antihistamines, including over-the-counter sleep aids containing diphenhydramine, have profound anticholinergic effects that directly block salivary gland stimulation. Reducing all three has an immediate and measurable impact on morning oral moisture status. Step 5. Do not self-diagnose. Use this video to have a better conversation with your physician. Everything on today's list is a condition that requires clinical investigation to confirm. The goal of this video is not to give you a diagnosis. It is to give you the knowledge to have a productive conversation with a physician who can investigate properly. Bring your symptom diary. Mention the specific conditions you have learned about today. Ask for the specific tests. That informed, specific conversation is the most important action you can take. As an endocrinologist, I have spent my career studying the hormonal systems that regulate how the body maintains its internal balance. And one of the things that strikes me consistently is how eloquently the body communicates imbalance long before that imbalance becomes crisis. The morning dry mouth that millions of people experience and dismiss is, in the framework I have just described, a sophisticated physiological communication. It is your thyroid, your adrenal glands, your autonomic nervous system, your cardiac output, all of them capable of expressing their status through the common final pathway of salivary gland output. And for years, sometimes for decades, people receive that communication and respond to it with a glass of water, a shrug, and the assumption that it means nothing significant. I want you to respond differently. Not with alarm, but with attention. With the kind of informed, specific attention that prompts a conversation with a physician who can investigate properly. The 5 conditions I described today, nasal obstruction, cortisol dysregulation, hypothyroidism, silent GERD, and early heart failure, are all conditions that respond better to early identification than to late identification. In every case, the gap between finding it early and finding it late is measured in quality of life, in treatment options, in outcomes. Your morning dry mouth may be nothing significant. For some of you, it is simply a hydration issue that a better water drinking habit will resolve completely. But for others, for the person watching this who has had this symptom for months or years alongside fatigue, or swollen ankles, or cold intolerance, or that slightly bitter morning taste that never quite makes sense. It may be the symptom that finally points toward an answer. That answer is worth pursuing. Starting with a comment below, your age, your experience, and whether anything from today's video resonated with something you have been noticing and not quite naming. Share this with someone who dismisses their morning dry mouth as unimportant. You may be giving them the framework that changes their next physician visit from frustrating to genuinely productive. Subscribe for weekly content on metabolic health, hormonal medicine, and the symptoms your body uses to communicate before it has to shout.